briefing on our ongoing pandemic response efforts. And providing interpretation for us today is Margie Prop. Thank you once again, Margie. And thank you to you for joining us to learn more about the latest local developments. Since early last year, we've been running a race against the novel coronavirus. Our major goals have been to prevent more illness, death, and disruption, and to prevent our hospitals from becoming overburdened. In the earliest days, all we had were common sense measures: masks, hand washing, social distancing. And these non-pharmaceutical interventions alone were not enough to keep us in the lead. What we had hoped was a sprint became a marathon, and it's one we are still running. The development of safe and effective vaccines gave us a second wind and a real shot at winning the race. And with the support of so many people in our community, we took the lead. But just as the finish line was in sight, more hurdles were put in our way. The Delta variant, a more contagious strain of the virus that is more likely to land people in the hospital. Misinformation that created vaccine hesitancy in too many of our community members. And the mistaken notion that we have already reached the finish line, that the pandemic is somehow past us. Our pace has slowed, and the virus is again challenging our resources. And it's natural to be exhausted at this point, but we cannot afford to quit the race now. There is too much at stake. To beat the virus and reach the finish line, we need to find the strength to keep going. And that strength comes from our support team, the members of this community. Anyone who has run a real marathon knows that the actions of just one person can make a difference. The funny sign at mile 10 or the cup of water at mile 20. Each individual who supports the effort has the power to keep you going. Small individual actions can have a huge collective impact. And that's what we need again. Every member of our community taking action to help us win. Please, please, if you are eligible to be vaccinated and have not yet done so, do it now. Wear your masks. If you've been in contact with someone who has contracted COVID-19, get tested and take steps to protect yourself and others. Health Director Pat Lopez will now give us the latest data on our local situation.
Thank you, Mayor. We continue to stress that the actions we're taking as individuals and together as a community, actions like getting vaccinated and wearing a mask, will help us get through the current surge that we're still experiencing. Fortunately, we continue to see improvements in our case numbers and positivity rate. But at the same time, the number of COVID-19 patients hospitalized remains extremely high, straining our hospital capacity. The Delta variant is still circulating at high levels in our community, and our overall situation remains critical. The number of new cases has declined and is starting to flatten. The 7-day rolling average of new daily cases shows this decrease over the past few weeks. We went from a high of 140 cases on August 30th down to 99 cases toward the end of last week. This represents a 29% decrease, which is very encouraging. We need to see that downward trend continue. The decline in new cases is supported by the slow decline in the positivity rate. That has dropped from a high of 12.7% the week ending August 21st to about 10% over the past 2 weeks. As I mentioned, the number of COVID-19 patients hospitalized locally remains extremely high, and hospital capacity continues to be a serious concern both in our own community and every community statewide. The 7-day rolling average of COVID-19 patients in Lincoln hospitals remained steady last week between 105 and 108 patients. On this chart, you're seeing the steady average of hospitalizations over the past week is depicted by the top blue line. When you break that down, you can see that the number of patients from Lancaster County, represented by the orange middle line, has declined from a daily average of 72 down to 62. The number of hospitalized patients from other communities, depicted by the bottom yellow line, has continued to increase from a daily average of 36 up to 47. The decline in Lancaster County patients reflects the lower case numbers we are starting to see, but we continue to serve many other communities in our region, and our Lincoln hospitals are full. Today, a total of 105 patients are hospitalized, and 24 of them are on ventilators. Just over half, or 55 of these patients, are from Lancaster County. Sadly, 11 people have died from COVID-19 so far in September. 8 were unvaccinated, and we will be reporting one more death today of a person in their 20s. We are encouraged by the improvement in our number of cases, but we need to see continued declines in new cases and the positivity rate. We also need to see a decline in COVID-19 patients needing hospitalizations. For these reasons, the risk dial remains in the mid-orange range again this week. Orange, as you know, indicates the risk of the virus spreading, and the impact on our community continues to be high. The key metrics of positivity rate and case rate remain in the red category. Hospital capacity and deaths are in the orange. Vaccination rate, contact tracing, and testing turnaround time all remain in the yellow category. The current position of the dial is indicated by the blue square outlined in red. Throughout the pandemic, we've had many great partners in our business community. With the guidance of the health department, the vast majority of our local employers have been taking all the steps necessary to keep their employees and customers as safe as possible. This includes encouraging or requiring vaccination. And from a health perspective, getting employees vaccinated is the most important thing employers can do during this Delta surge to ensure that their workers stay healthy, their business operations are not disrupted, and the needs of their customers are met. Masking is also a proven strategy in preventing the spread of COVID-19 in the workplace or to customers. Joining us today to share some information on slowing the spread of COVID-19 from a large business perspective is Jim Townsend, Corporate Manager of Safety, Training, and Development and Wellness at Kawasaki. Jim?
Thanks, Pat. At Kawasaki, we were very pleased to with the leadership from the mayor and the Lincoln Lancaster County Health Department. From the beginning, it was really challenged. It seems like forever. I love the marathon analogy that the mayor used for the health department to partner with us and help us bring people back to work, review our return to work protocols to make sure we were doing the right things and doing it safely, to currently where having the courage and the strong leadership to set the mask mandate and allow us to keep our employees at work and building our high quality products. That's what we're looking for to do. And masks work, and they've proven to work at Kawasaki. Most of the spread in our population at Kawasaki is from community spread. And so therefore, having a mask mandate at Kawasaki, but also a mask mandate in the community helps keep our employees healthy and helps them stay at work and not end up in the hospital. And so I'm talking about that. The health department's been very willing to come with us and work with us to come on site and get our employees vaccinated. Those that are willing, we're highly encouraging, and we're allowed them paid time to go get vaccinations at Pinnacle earlier when we were doing mass vaccinations. But now those that want them, the health department's been willing to come on site and work with us to do on-site vaccinations. We're in this for the long haul, and getting vaccinated employees will allow us to continue our business operations and make our great quality products. So with that, I just want to thank the mayor and Pat and her Lincoln Lancaster County Health Department staff for their strong leadership and partnership with Kawasaki, and let the good times roll. Thank you.
Thank you, Jim. We appreciate the work Kawasaki and our other businesses are doing to protect the health and safety of their workforce, which in turn helps protect our entire community. Our businesses have really reached out and been fantastic about all of us working together for the same common goal, to keep workers in the workplace and keep our economy thriving, and to do that as safely as possible. We continue to stress that vaccination is the best defense against the Delta variant, which hits people harder and faster and is causing more severe illness, particularly among those who are unvaccinated. Thanks to our residents, Lancaster County continues to lead the state with the highest vaccination rate. About 73% of the Lancaster County residents aged 16 and up are fully vaccinated. Remember that 73% is just for those aged 16 and up. We look at the vaccination data for all 319,000 plus Lancaster County residents. 59% are fully vaccinated. That means that about 41% of our residents are still not fully vaccinated. That's around 131,000 people. Some of these residents are children under age 12 who are not yet eligible for vaccine, which make up 16% of our population, or around 52,000. They're noted in the dark gray area on the chart. Almost 11,000 of our residents have started the vaccination process but have not yet completed it. They are represented in the gray-blue area. If you've missed receiving your second dose, it's important to get it now. The orange area on the chart reflects others who are eligible for vaccination but haven't yet received it. That's about 21% of our population, or close to 68,000 people. We strongly urge every person who is eligible to get vaccinated. By getting vaccinated, you're protecting yourself. You're protecting those who cannot be vaccinated, including our children. You're preventing further variants from developing. And you're doing your part to keep our schools and businesses open. In short, you're helping to protect our entire community. Even if you've had COVID-19, the recent research shows that vaccination can offer additional protection against reinfection. Late last week, there was an important development related to COVID-19 booster doses that I want to touch on briefly. On Friday, a Food and Drug Administration advisory panel voted to recommend a booster of Pfizer COVID-19 vaccine for people 65 and older and those at high risk for severe illness from COVID-19. The booster dose would be given at least 6 months after the second dose. COVID-19 vaccines continue to provide strong protection against severe disease, hospitalization, and death, but it's common for protection from vaccines to be decreasing over time. Federal officials have said a booster dose of COVID-19 vaccine could be needed to maximize protection. The next steps are for the booster doses to be authorized by the FDA, Food and Drug Administration. Then a CDC advisory committee will conduct its review. The committee will decide whether to recommend the use of the booster dose for the group specified. Then the CDC will need to sign off on the recommendation. Until that occurs, booster doses are not yet available. Once they are available, the health department will share information on available options for people who are eligible to receive their booster dose. The booster dose recommendation only applies to those who have received Pfizer vaccine. Potential booster dose recommendations for other types of COVID-19 vaccines are still being determined. The health department and several local pharmacies continue to administer third doses of vaccine, which are different than a booster dose. Third doses are given to individuals who have weakened immune systems. That includes individuals receiving cancer treatment or those who have had organ transplants. These individuals are more vulnerable to COVID-19 and may benefit from an additional dose to ensure they have as much protection as possible. Yesterday, Pfizer announced its COVID-19 vaccine is safe and effective for children 5 through 11 years old, and the company will be seeking emergency use authorization for this age group. The company is expected to submit its formal application and detailed data to the FDA soon. Well, there is no firm timeline for this age group. We have met with local pediatricians and are working on plans for providing vaccine to children ages 5 through 11 as soon as it becomes available to help get those protected as quickly as possible. Vaccine is available every day at clinics and at local pharmacies. We keep a robust clinic calendar with several vaccination opportunities each week. We continue to work with community partners to host neighborhood clinics that help make vaccination accessible, convenient, and close to home. Over the weekend, we had successful vaccinations provided at the Latino Festival and the Harvest Moon Festival. We also continue to work with schools, colleges, and universities and have several clinics scheduled on site throughout September and into October. Upcoming clinics are also including those offered at the health department each week. Every person vaccinated helps create needed protection for our community. You can find all upcoming vaccination clinics at covid19.lincoln.ne.gov or by calling 441-8006. You can also find local pharmacies offering vaccinations at vaccines.gov or by texting your zip code to 438829. I think somebody's not muted. Andrew, I think Andrew.
Yeah, I know. I mean, just to strap a growth pro on a person, I wouldn't go up. And
Thanks. Getting vaccinated and wearing a mask are the proven prevention strategies that help protect our community and will get us through this surge. We are encouraged by the reduction in the number of new cases, but our hospital capacity remains critical. And we need to keep our efforts to get all of our numbers moving in the right direction. We do want to remind everyone that the current directed health measure remains in effect through September 30th, and masks must be worn indoors. Our actions have been and will continue to be guided by the latest data, and residents can track our local data daily via the COVID-19 dashboard. We also issue our COVID-19 updates every day that include the latest data and information. These are all posted at the covid19.lincoln.ne.gov website. Click on the COVID-19 News Release button on the top left side. You can also find the updates on the city's homepage at lincoln.ne.gov. Just scroll down to the latest news section. If you use social media, you can follow the City of Lincoln and Lincoln Lancaster County Health Department on Twitter and Facebook for COVID-19 information updates. And if you have COVID-19 questions, or if you're seeking general information and resources, the hotline is operational Monday through Friday from 8 to 4:30 at 402-441-8006. And with that, we'd be happy to take any questions. Jared.
Hey, Health Director, so obviously you said there the mask mandate is expected to expire in 9 days. Don't know really where it's going to go yet, but I believe last week you said as well the next 7 days, or the last 7 days it should be now, that is going to be really telling about what you will learn about maybe potentially extending the mask mandate. So I guess what did you learn in those last 7 days?
Well, we continue to see that we're, at a level pace right now, and our cases have gone down, like I said, 29% since that date, but we're going to need to continue to see a sustained momentum of our cases decreasing and our hospitalization rate improving.
And is this something you're already having conversations about?
Yes, we're continuing to review all of the data and evaluate what we're seeing as trends in the community.
If you don't mind, I'll ask another question for you. So since the vaccine rollout began, you've been really stressing the goal for Lancaster County is 75% of the population being fully vaccinated, that's 16 to plus population. Right now we're at 73%. Is that 75% still a goal, or are you guys looking more at the entire population vaccination, which is 59%?
We're looking at the entire population, but the 75% was our initial first goal based on our 16 and over population. We're anticipating in a couple of weeks that we'll reach that goal, and then we'll work forward from there on our next set to get by then our 5 to 11 years old and merge to our whole population that's eligible. And we're at about 59% of our total population right now fully vaccinated.
And having that goal of 75% of that 16 plus population, I guess, what does that mean when Lancaster County gets to that point? It's just like, we did it, or what kind of comes from that?
Well, I think it shows a tremendous response in our community. We have the highest number of individuals in that 16 and over fully vaccinated, and it's something that gives us some reassurance that we've really been able to reach that portion of our population so well. And it shows us that we can go on and go further from there.
Thank you, Health Director.
Hi, Pat, it's Matt Olbrich, Journal Star. Hey, I wanted to ask you, when you guys are looking at hospital numbers in terms of, adjusting the risk dial or adjusting the directed health measures, are you paying more attention to the patients that are actually from Lancaster County? Or are you looking at the total hospitalizations? Because obviously over the past few weeks, it's kind of shifted. The number of Lancaster County patients has gone down, but the hospitalizations really haven't, because that's been filled in by more out-of-county residents, which I'm sure the hospitals are able to take, when there's fewer patients from the county.
What we see is our numbers have gone down for Lancaster County residents since we initiated the mask mandate. And I think it's important for us all to remember we have a crisis in our state right now with not enough hospital beds for individuals that need them, not only just for COVID, but for any type of traumatic injury, heart injuries, and our community has always supported and provided care for neighboring communities. Our hospitals have moved individuals out who are not at the most critical stage to some of our neighboring communities in the critical access hospitals to do additional recovery and receive additional care there. So it's really a process where we work together with the surrounding communities and move patients back and forth so we can get people at the right level of care at the right time. I do know, we still continue to see an issue with patients waiting in the emergency department to be admitted and to receive care. I do know that across the state, this has continued to be an effort. So yes, we consider all those things, but our hospitals are going to be required to take patients, and we have to make sure that they're able to take care of our community members.
Okay, thank you.
Okay, thank you. I appreciate everybody tuning in today, and be well, wear your mask, and get vaccinated.